So we're going to talk about how to talk about this criminal code repeal that we're going to do here in a moment. Okay. So OHMM then, Ohio Health Modernization Movement, is a coalition of organizations and individuals dedicated to ending the criminalization of HIV in Ohio, or modernizing it as well. You all kind of know that. You're not new to us for the most part. Today, what we're going to do is we're going to talk about the state of the law, then the proposed changes to the law, understanding what those changes actually are, and then some help with how to talk about it to decision makers. So that could be people in your own organization, or it could be legislators, or it could be another decision maker somewhere. All right. So let's start real briefly, because most of us already know a lot about this, is the state of the law, that there are 6 criminal statutes in Ohio, and they're listed here. So there's this, 4 of them are an extra penalty. So they're already illegal, and there's an extra penalty if somebody is a person living with HIV. So that's the solicitation, loitering, prostitution, and harassment of bodily substance. The other 2 make behaviors that are not against the law for other people, against the law for people living with. And that is the felonious assault code and selling or donating contaminated blood. But we're really only going to talk about one of these today, and that is selling or donating contaminated blood. So if you've been following our research presentation recently, you will probably have read in there that we found really that this law is not used. We found 2 or 3 arrests, but no charges, no convictions. So it's a law that exists, but really isn't being used. We don't foresee, we foresee very little opposition to it. And that the FDA policies have kept the blood supply safe from HIV and other blood-borne pathogens for a very long time. All right, so what we're going to do today is when we talk to people, we want to educate on the content of this repeal alone, so that they understand what this particular bill that we're going to be introducing later this week does. And then we want to educate them as much as possible on the modern scientific understanding of HIV. That will also be the underpinning of all the other bills we plan to do in the near future, because it is totally our intent that we will go back and address all 6. We're just starting with this one. So I want to, just as background, let you know that there is this public health code law, and we won't go through the whole thing, but for those people who like to read laws, it's up here for you. But this isn't a public health code, and it's a general misdemeanor if you fail to tell somebody that you've got a contagious disease, or if you don't somehow prevent exposing them to your contagious disease. And it applies to all. It's not an HIV specific law, but it is a misdemeanor of the 2nd degree. And I want you to know that it exists out there, and we are not touching this. This will continue to exist and would be an option, right, if somebody felt that they really needed to bring some charge against somebody for exposing somebody else to a contagious disease. Is there any questions about this law before I move on? And you would put them in the chat, and Maria is going to translate for me. All right, well, Maria, if something comes up, just let me know. Okay. So then, this is the current law that we don't like. All right, so this is selling or donating contaminated blood. It was effective July 1st of 1996, and it was passed in the 121st General Assembly, and it was Senate Bill 2 at the time. How it reads, right? No person with knowledge that the person is a carrier of a virus that causes acquired immune deficiency syndrome shall sell or donate the person's blood, plasma, or a product of the person's blood if the person knows or should know the blood, plasma, or product of the person's blood is being accepted for the purpose of transfusion to another individual. That part about should know, is something we need to be aware of, that it doesn't actually require you to know. It's just somebody thinks you should know. Interesting. And then B is whoever violates this section is guilty of selling or donating contaminated blood, and it's a felony of the 4th degree, and it only applies to HIV, does not apply to other diseases that are, where they don't take donations. So Hep C, Hep B, syphilis. There's a lot of other conditions that they don't want to take donations from, but this only applies to people living with HIV. Sorry, Maria just got booted off. She's trying to join again. Okay. So in less legalese, right, what does this mean? So if you just means if you're a person living with HIV, that state law prohibits you from selling or donating blood, plasma, or any blood product. It's actually a federal law as well. But we're talking about the state law. And what is the punishment? It's a 4th degree felony, which is 6 to 8 months or a fine of up to $5,000. Any questions about the existing law? Carrie, until Maria gets back, can you see if there's anything that shows up in the chat that I need to pay attention to?
Sure, there's a comment from, can you hear me?
Yep, I can.
Okay, there's a comment from Adam, and I'll just read it. We could use this as a way to, and I believe Adam's referring, well, maybe not Adam. You can clarify. Adam says we could use this as a way to say the law we're trying to change doesn't really change anything for anyone else and only makes those living with on the same legal footing as everyone else. And Adam is referring to the previous slide.
Yes, he is correct that we don't want to make anybody think that, oh, the answer is to bring everybody else up into that felony category. That we do not want. And we're going to get to why that wouldn't make sense either in a minute, but Adam that is true. All right. So we'll move on, but again, I think Maria's back, so she can look at the questions if you have them. So now that we know what already exists, we're going to look at what we're proposing to change. So we don't have the bill number yet. The bill gets, quote, dropped, which will happen yet this week, is my understanding. And then it has to be assigned a bill number. So we hope by next Tuesday, when we're having our press conference, which we'll talk about a little bit later, that we will have that bill number. So I have the X's in there just to represent it until then. But it really, the repeal language is as short as what's on the screen. It's section 1. That section 292713 of the revised code is hereby repealed. It's not very complicated. It seems really simple. Any questions about this before we move on? Okay, I'll assume there's not, but Maria, just interrupt me if there is. All right. Oops, okay. Here's one complication. When the bill gets created by the organization, the Legislative Service Commission, I think LSC, they write a description of the bill. We don't actually get to write the description. And the current description that they wrote is here. So it says to repeal section 2927.13 of the revised code to repeal the offense of knowingly selling or donating contaminated blood. I'd love you to put in the chat if you see a problem with this and the way it's currently written. Maria, can you tell me if there's let me see if I can see the chat. Okay, so lacks context. It would be nice if it had more knowingly, the word knowingly. Knowingly is actually a legal term. that we may not be able to get rid of. That has nothing to do with sex. That's true. That's true. Here's what I see when I look at that. It actually, if I didn't know what I was, well, you know, if I didn't know as much as I know and I looked at that, I might think that this meant that by repealing this law, that people living with HIV could now go donate blood and blood plasma. And that is not the case, right? Because people living with's ability to donate blood and blood plasma is controlled by the FDA and like the Red Cross and that kind of thing, not by this law. So we're going to get here in a minute. So all this law does is repeal that possible felony charge. It does not change the idea whether people living with can donate blood or blood plasma. It does nothing to that. This is called the pause when my cursor won't move forward. Okay, so let's look more at this, and Maria, jump in if there's anything up there in the things. So back to this complication is how do we, if we can't change this description, and we're trying right now, but if we can't change this description, this may be the only thing a legislator reads about this bill, is that little description, that one sentence. And I know because I've talked to enough people about this, and I, you know, thought that everybody was on the same page, and turned out they weren't, that people have thought that by repealing this, that people living with HIV would be able to donate blood and blood products. And so I know that confusion is a possibility. All right, so what it doesn't do. So people living with HIV, all right, and the other conditions, Hep C, syphilis, there's several other conditions, who, by the way, don't face this felony threat, they will still not be able to donate blood or sell blood products, which is plasma for the most part. They will either be screened out of the process by answering questions. If anybody of you have gone and tried to donate plasma or blood, there's a whole series of questions you get asked, and a lot of them are about, you know, risky behaviors, including sharing syringes or the type of sex you're having. All of those kinds of questions are asked, right? So people would be screened out of the process, or the tests that happen on their donation already will get their donation destroyed just like they are right now. And the donation site computer systems, so the Red Cross and plasma centers have computer systems. And if you test positive for one of those, for HIV or Hep C or any of those others, they permanently defer you from donating and put it in their computer system. Now, how wide are they sharing the data? But that particular center would forever know that you were deferred. All right, and so the next time you came in, they would just stop the process pretty quickly. Any questions about this? Or people out there who know a whole lot more than I do who want to add something? Let's see.
Ryan said, and that test results get reported to the local health department.
Yep, actually, that's in a screen coming up. Yes, test results, if you do test positive for anything, it does get reported to the health department. That will not change. It'll be the same. I have to close the chat, and I can't watch it if I want to be able to make my screen move forward. There we go. Okay, so what does change? What will change is that people living with HIV will no longer face a possible felony charge if they attempt to donate blood or sell blood products. So again, I want to repeat, it does not, what we're trying to do here does not make it possible for people living with HIV or Hep C or anything else to donate blood or sell blood products. It simply takes away this felony charge that only affects people living with right now. Any questions about that?
I'm reading Francesca's comment now here. There's always a screening and they do the test before allowing someone to donate. This is important information for the public to know. With the digital age, the names go into a database for deferring your donations. Is that database in the national, state, or local level?
I don't actually know that. Do you, Carrie? Okay,
Yes, it's only for plasma, and I'll put the, that has the National Do Not Donor database. Whole blood donations don't have that. And I'll put the link in the chat so people can take a look at it.
thank you. All right. So now we're going to go through a little bit of right now. This is straight off the Red Cross's website, this next section. So what happens when you go to donate blood and will still continue to happen? All right, we're not changing any of this. And this is kind of what Francesca was saying, that prior to donating blood, all donors receive a free health screening. Everything's checked out. They record those vitals, et cetera, in a donor profile. That's that computer system where you track and monitor your results. Each blood donation gets sent to a lab to undergo the following. There's several things, but one of them is infectious disease testing. And this is the tests that they do. They test for human immunodeficiency viruses, types 1 and 2. They do antibody testing and nucleic acid testing. So they call that NAT, and remember that because it comes up in the next slide, which was implemented in September of 1999. If you remember, this law that we're trying to repeal was passed in 1996. So it was prior to NAT.
Kim, I'm flagging a question from Brian.
Perfect.
What's confusing to me is when might a person know their diagnosis? As it stands now, if you tried to donate and had never been tested, would they prosecute, is what I assume that's supposed to say. And then Francesca asked, great question. That person trying to donate would not be knowingly donating or selling.
Yeah, they'd have to prove you knew that you were living with right now in order to prosecute. So if you were the first time donating, that it would be unlikely for them to be able to prove that you knew if you truly didn't, like if you didn't have all record already with the health department. If you're already on record with the health department, that they could find. But if you went in and you tried to donate and they found that you tested HIV positive and they send you a home letter, I have been trying to get a hold of a copy of these letters. I have been unable to get it for today, but I'm still looking for it. But the letter goes, and if you didn't understand what the letter was trying to tell you, which is possible, and we actually have stories in Ohio of where that's been the case, if you went back and tried to donate, it's possible you could be charged with that felony because that letter would have been your notice that you tested positive and that you, quote, knew. And I know Brian and I have a lot of discussions about people living with's ability to, one, accept their status, that it may take time for that to happen, that they may not understand the letter, that there's all this kind of thing. But as far as right now, yes, that second time a person went, the fact that they got a letter could be used against them to say that they did know. But if we can repeal this, that would not be the case.
Kim flagging in the chat. Brian asked, what about mental health comprehension? And Francesca followed up. How would this affect someone at the undetectable level as well? Yeah,
right now, these laws don't take undetectable level into account. It's meaningless in terms of the current laws that we're trying to modernize and repeal. And the laws do not take into account the mental health, and that's kind of, Brian and I have talked about this before, the mental health of the person living with and whether they understand or accept their diagnosis. That is not taken into account. But again, remember, as far as we can tell, this law has never actually been used. Those letters that go to people who donate have been used against them in other laws. But as far as we can tell, there have been a couple of arrests that there were arrest only, and the person was never charged, never convicted. But those letters have been used in, I know, and Brian knows a felonious assault case where that letter was used. That,
And
go ahead,
sorry,
Maria.
follow up from Brian. Brian says knowingly has to mean comprehend. So I think if you want to talk a little bit more about that difference, Kim.
Yeah, so Brian, they're not using knowingly, but as the dictionary definition, there are, and Maria, you could help me with this too,
Yeah.
as a lawyer. There are 4 words that Ohio legally uses to indicate levels of intent to do something. So you can purposely do something, and it has a very specific legal meaning. You can knowingly do something, and it has a very specific legal meaning. You can negligently do something, and it has a very specific meaning. And there's a 4th one, Maria, that I'm blanking on right now.
Recklessly is
Recklessly, yeah. So to the best of your ability right now, knowingly, Maria.
Yeah, so the difference is that knowingly is the lowest tier in that it basically means made aware of. It doesn't mean anything much deeper than that. So if you were made aware of whether we believe that was a sufficient alert or not, then that is that knowingly standard.
Right. So knowingly does not mean the same thing in this situation as it would out when we are talking about knowingly in the world and just in general conversation. It actually has a very specific meaning. And it is not, it's that letter would mean that you know legally that you're a person living with. Even if you don't accept it or your mental health doesn't allow you to understand it, you still quote no. I get that frustration, I do, but that, it is what it is. Anything else out there, Maria?
Brian asked, what about boat right in Akron?
Yeah, that's the case that we were talking about where somebody got one of these letters after attempting to donate and later was charged with the felonious assault. And the fact that that letter had been sent to them, and I don't know this case really well, so I may be slightly off, and I'm not a lawyer, by the way, but that the letter was used to prove that this person knew they were living with HIV, and therefore they were charged and convicted of the felonious assault later on. But that's not actually, that's a side issue to repealing this particular law because he wasn't charged with the felony for donating blood or blood products. Is that it for the chat right now, Maria?
Yeah, and then Dr. Foote just had a little note about Indiana's experience where they did have someone actually get prosecuted as opposed to ours, and just noted that, it's a little easier to get a law off the books when prosecutors aren't regularly relying on it.
Yeah, and that's kind of why we are choosing to start with this one, and I'll talk a little bit more about that. It's partially because it's not being used. Nobody's going to say, hey, we want to keep using this because it's just not being used.
And then Brian added, Brian, I'm not sure I'm totally following the question. What does the blood bank tell you, your diagnosis, or the city?
This is the one I went to the blood
Who
plasma
tells
center.
you? Okay.
Oh yeah. I went to the blood plasma center yesterday and talked to them. They have to go to corporate in order to show me the letter. But yeah, they send the letter. And then they also report you to the health department, and the health department may also notify you. I would imagine they do, because they're going to want to get you into care. But yeah, the plasma center would send a letter. I know that one of the questions the plasma center asks is, can you be reached at your current address for the next 8 weeks? So they do ask a question that tries to get at, if they mailed you something, would you actually be there to receive it? It is one of the questions they ask. Okay, so just as a note, in case anybody asks, we're going to come back to this in some talking points later, but since the first implementation of that NAT testing, in 1999, only 5 transfusion-transmitted HIV infections have been documented anywhere in the country. And that's because of this approximate 7 to 10 days right now that when an infected donor may not be detected by blood donation screening, but this donor would also not know they were living with HIV. So they wouldn't be subject to the law anyway, but there's very few transfusion transmitted cases since 1999, only 5.
Kim, I'm playing one more question from Brian
Yep.
about the letter, as far as what does it actually say in that letter? Does it say your diagnosis and or that you can't donate? And then just flagging that Adam Riley clarified that they're not telling people verbally, just through the letter.
Right. Brian, I really tried yesterday to get a copy of the letter, but they have to go to corporate to give it to me. So I don't actually know the words in it right now. But as soon as I do, I'll share it. All right, that's it. Okay. So this is, so thanking Dr. Carey for this. This was a part of a letter that the Indiana region of the American Red Cross wrote back in August of 2022. Right, so this is, because we get asked a lot when we're talking about this, what does the Red Cross think? And so the Red Cross is required to follow federal FDA guidelines for blood collection and testing. Right, they operate a national blood collection system involving many states. All right, they've acknowledged that there's a patchwork of laws in the U.S. concerning disclosure of HIV status. A small number of states criminalize such behavior, most do not. 7 is the last number I saw on the CHLP website, is there's 7 states, including Ohio and Indiana. According to the Red Cross, criminalization is not an FDA recommended measure. And as these criminalization laws are inconsistent across the states in which we collect and distribute blood products, the Red Cross does not rely on criminalization to protect the blood supply. Instead, we carefully follow FDA guidelines. So that was a statement made by the Indiana region of the Red Cross. And I'm happy to say that I talked to the Ohio Red Cross folks, and they are preparing a very similar letter, just like this. They may be able to update it since this is now almost 2 years old. But they are on board to say the exact same thing to our sponsor in a letter, and they are working on it already. Any questions about? Go ahead, Maria.
I'm flagging a couple of comments in the chat. Dr. Foote clarified that sometimes it varies state to state, but the Department of Health may also reach out. Ryan elevated that when Ryan worked as a DIS, a mailed letter didn't necessarily count as knowing your result, and that someone like a doctor or DIS has to confirm or document that they notified you in person as proof of knowledge of status. And then Brian clarified actual confirmation comes from the health department. And does health department bring in for confirmation? I don't know quite what you're asking there, Brian, but I'm happy to help.
I mean, what we know, or what we believe we know, because we haven't talked to the lawyer involved, but we have that one case where the fact that the letter was sent was used as proof that the person knew they were living with. But again, I'm not a lawyer, and I haven't actually talked to the lawyer involved in that case, but that's what we believe to be true. Brian knows it better than I do. All right, so this is what we know the Red Cross says. We know that Ohio is going to put out a very similar letter for us, and that'll be great. I did send them this one so they can see. If you're just curious, I literally emailed this guy this morning, and 10 minutes later he called and said he was totally on board. It was a really quick, yes, we're there. They knew this was coming. They were happy that we had called. It was a great way to start my morning. All right, so is the same thing's pretty similar for plasma and other blood products, right? In addition, I happen to know, because I did this just so I could find out what happens, your first donations are not, when you donate plasma, your first 2 donations are not given to any recipient. They simply hold them for testing purposes. And there is a heating process that plasma goes through that also has a negative effect on the HIV virus. I'm not going to say that it kills it entirely, but it does definitely has a negative effect on it. All right, we already covered this because we were talking about it, but that, Ohio law still says that the plasma and the blood donation have to report donors who test HIV positive to the Ohio Department of Health. Linkage to care and disease intervention policies relating to reporting will remain, and donors are also notified that they have tested positive via letter. All right. Are there any questions about the existing law, the how we're changing it, and any confusion left as to whether this affects the ability of people living with to donate blood or blood products? That's what I want to make sure that we have no confusion left around.
Nothing in the chat.
Okay, excellent. Maria, could you drop my email address in there in case anybody has a follow-up question they want to ask later?
Yep.
Thank you. All right, so then there's the question about how do we talk to decision makers? And this is why Dr. Carey is here with us today, is to talk about this piece of it. So Dr. Carey, well, I got to keep sharing because, and Dr. Carey, just let me know when you want me to move a slide.
Okay, I'll take it from here. So thank you all for having me. I'm really honored to be with my colleagues in Ohio because you're in it for the long haul like we are in Indiana. We've been going on with reform efforts and advocacy efforts now for 8 years, and it's a very long marathon, and we're still running, not going to give up. And like you, we have a law in our state that also criminalizes attempts to donate while knowingly living with HIV. So I'm a professor of sociology. I do research in this area, but I'm also chair of a grassroots movement called the HIV Modernization Movement Indiana that was formed in 2016 by people living with HIV who learned about the issue. Of course, it directly affected us. I am a woman living with HIV since 1988, so a very long time. That was the year our blood donation law was enacted, a very long time ago. We've just been, like you guys, working very hard to do education and advocacy. So with this particular law, we're also like you. We have a hodgepodge of laws in our state that criminalize people living with HIV. And ours is very similar to yours with the attempting to donate blood products. You have to know your HIV status in order to be criminalized. Unlike you guys, we have had prosecutions in our state. We've had at least 20 court cases, and of those, many of them have been prosecuted and charged and convicted under our laws. And the reason, I always wonder, like, why is our law used and then our neighbor's law, you're not finding any court cases in your data? And ours was directly linked to a health policy. So that's just something to be aware of, what people on the ground are doing linked to these laws. It was actually the Department of Health staff who was calling the police on people, using our confidential information in the databases, looking up when they got reports from blood donation sites, plasma sites of, hey, we've got someone who's HIV positive. The policy, which is a great policy, was to find out, do we have this person in our database? If we don't, they treated it like someone newly diagnosed, send their DIS out to investigate, try to link them to care and all that. But the policy up until a few years ago in our state was to actually, if they knew they were HIV positive, and we used to have to sign forms in our state when we test positive that informed us about these laws, then we knowingly broke the law if they had these forms unfiled, and they actually called the police. It was horrific. The good news is we stopped that on the ground. So it shows your advocacy and your education can work. So if you find a policy or anyone doing things linked to this particular law that is just unjust, adding to stigma and discriminatory, you can stop that even before changing the law, because there could be things happening even though they don't end up in court cases. So one example of something that happens that I wanted to share, because it was a real eye-opener with me, was how this particular law can negatively impact people who don't know their status, and we want people to know their status. So next slide. This is a story of one of our members on our network of when he first tested positive, which was through donating blood. He was going to school, he was on a college campus, they had all the time, the Red Cross comes here, they set up their donation sites, and everyone goes, oh yeah, I'll donate blood. And he went to donate blood, and that's how he learned he was HIV positive. And when he was called in for his confirmatory test results, this is what happened to him. I received my diagnosis from a blood center. The doctor that gave me my diagnosis was particularly malicious in their delivery. As soon as I entered the room, they said, you have HIV, which means you committed a felony by donating. And if you didn't know you were infected, you still broke the law by donating after engaging in risky behavior and then certifying to us that you were not. You're lucky I didn't have the cops waiting here. So are you shooting up or sleeping with men? Then they handed me an envelope with my lab results and told me to leave. I was a nervous wreck for days afterwards, worrying that there was still a chance that they might press charges. When the DIS showed up on my doorstep, I almost lost it. So you can just imagine, here's this young man, newly diagnosed, learning his status, and this is what happens to him because we happen to have a law in our state that makes it a felony crime, just like you guys do. So these could be stories that happen on the ground that we don't even hear about because of negative impacts of a law. So I shared that only to say that while, because there's this thing like, well, that law isn't even used, don't worry about it, just let it hang out there. The harms and the stigma are much more than, being actually arrested on how these laws contribute to stigma. And that was an eye-opener because I never thought about that. Somebody, learning their status through the blood supply. So I'm going to talk to you a little bit about how we talk to particularly legislators around this law and some of our experiences. We have passed our House chamber 3 times. You can go to the next slide. We've passed our House chamber 3 times with full repeal of our law. We run into problems with our Senate with all our laws. This one's not unique, and we've rarely gotten a hearing in the Senate. But in the House, we've passed 3 times, full repeal. And when we've talked to legislators, certain questions seem to come up, certain concerns. So what I'm sharing with you here are what we found to be the most effective talking points. And I know we're different states, we have different, contexts and that sort of thing, but we do have similar politics in that we're a Republican trifecta, very conservative in many ways. So it's a similar political culture that we face, but there are differences. But I think some of this can transfer to the Ohio context. So 3 main points that we have found to be fairly effective with most legislators. Some you will just never reach, and that's okay. You don't need them all. You just need a majority of your Republican trifecta because they go as a caucus. So it's not a simple majority. It's more than that you need. And that's safety, accountability, and ending stigma. So in their mind, their biggest thing is they don't really care about like the stories I shared with you on the previous page. They don't care about the discriminatory effects towards people living with HIV and how we're singled out and treated differently under these laws. They couldn't care less in our state about that. Very few of the conservative majority will care about that. What they care about is the safety and that we don't pass our HIV on and transmit to other people. Fine, we get that. We understand that. We don't want to transmit HIV either. We're on the same page. But how do you convey that to them so they understand, we're not trying to make things, less safe, that these laws have nothing to do with safety. And in fact, they can make things less safe by people being afraid to go and get tested because you can only be arrested or charged or subject to these laws if you know your status, and they can be a disincentive to testing. And that's a bad thing. We don't want that. So we emphasize with them, they want to know, number one, our lobbyist always tells us safety, safety, safety. When you're talking to these legislators, reinforce to them that the blood supply will stay safe. People will stay safe. That's what they want to hear. And then accountability. We've also, and I'm going to give you some FAQs here that come up and how we've answered them. The accountability piece is, if some legislators can't wrap their brain around, how could someone who knows they're HIV positive walk into a plasma center and knowingly donate blood, even going through all the screening process, however they fill out their forms, and they still donate? And our response is, well, we understand, they're getting paid $40 or $50. They're desperate for money. There could be literacy problems. I know, Brian, you brought up mental health in the chat there. There could be, they're in crisis, they're in severe distress. They're not even thinking about what they're doing. We understand that, but the legislators don't care. They're seeing they knowingly broke a law, even if it's an outdated law, and especially if they get paid, they should be held accountable. So we've come up with answers to kind of appease and kind of, validate that concern. Like, okay, if you want to hold people accountable for that, there are still ways you can do that without this horrific felony conviction hanging over these heads or a specific HIV criminal law. And then ending stigma, because who's going to argue against that, right? Who's going to say we want to keep stigma? And we tie that to ending the epidemic, because we can't end the epidemic if we continue to have stigma, and these laws contribute to stigma. So it's kind of a bipartisan talking point that, no one's going to say, no, we want to keep stigma. So we always bring stigma in there because we've never gotten pushback on that. We always get kind of like the moral, ethical, well, of course we don't want to stigmatize anybody. And then you're on the same ground and you can have a conversation. So number one, will the blood supply stay safe? A resounding yes. And especially for advocates like myself, we need to learn that yes is a complete sentence or no is a complete sentence, particularly when you're talking to legislators. Because sometimes if you start to go on and you elaborate, you lose them, or they start thinking crazy things because they don't know the issue the way you do. And you share details with them and you start to get into the weeds. And because they don't know as much as you do, they start to think all kinds of, who knows what they're going to think and concoct in their heads based on their lives, their realities, their perceptions of who we are and the blood supply. So keeping it really short and simple and to the point when talking to legislators. If they ask for more details, by all means, share it with them. If they want to know exactly how the blood supply is kept safe, then you can pull up the article that shows the policy and all the different safeguards that are in place, from the screening questionnaires to the testing of the blood supply, all to, quarantining our blood, to heat treating blood and plasma, which automatically kills all viruses. So even eliminates that window of people who may not know their status. But most of the time, you don't need to go into that detail. It's just a resounding yes, definitive, confidentially, blood supply is safe. These laws have no impact on blood supply safety, but they have a whole lot of other harms. So encourage legislators, and we've done this where we've given them our Red Cross letter from the director of the Indiana Red Cross, and they still get a little skeptical about that. And so we said, well, go talk to your local Red Cross. And they do. And they tell them the same thing, that these laws have no impact on blood supply safety. And that assures the legislators that when they vote in support of a bill to repeal these, that they're not contributing to making the blood supply any less safe. So I would encourage them to do that, even on a local level. Another thing we've gotten is the personal experience of a legislator, and this can happen with any decision makers. Well, I had a friend who contracted it from HIV, from the blood supply. I feel really personal about this one, and I don't want to get rid of this law. What if it happens again? What if, what if all those safeguards fail? Isn't the law preventing that? And you want to show care and concern and compassion for their friend and their experience, and just say, I'm sorry about your friend that happened, and that, years ago, people did contract HIV from the blood supply, and, everyone remembers the hemophiliacs and Ryan White, and that's, but fortunately today, we've come leaps and bounds, and that's where you bring in the science and all these amazing things, and that in decades, literally 4 decades, We've had no one contract HIV from plasma-derived products. Incredible. For the blood supply, the last known was 2008, and it wasn't someone who knew their status. Someone who knew their status, we're going back to the early 90s, before the safeguards were in place. Because by the time someone knows they're HIV positive, all these measures that are put in place will screen out. And the burden of responsibility is on the blood banks, on the plasma centers. It's their responsibility, kind of like universal precautions, to keep the blood supply safe, not us. And it's effective, highly effective. So again, reassuring safety, blood supply safety. Another question we've gotten in our prosecutors when they support us now, but they didn't always support us, our Prosecuting Attorneys Association. But one time they brought in the federal law, and it kind of caught me off guard, because they were up there testifying. They said, well, we also want to keep this because there's a federal law against blood donations that makes it's a crime for people living with HIV. And then I was like, wait a minute, I didn't know there was a federal law. I knew there was like 12, states that criminalize this. And then the easy answer for that is, that law was enacted in 1988, and it's also outdated. It's also in need of modernization. It takes even longer to modernize and change federal law than it does state law. So it's a very simple answer. If somebody tries to hide behind the federal legislation on why we should keep Ohio's law. Next slide. And if there are any questions that come up, just interrupt me, because I'll keep going.
I'm just flagging. I think you probably ended up answering it, but Brian asked if we ever lean on the health code and saying that that's a better spot to take care of this quality control than criminal code.
Yeah, so that comes up in this one, and right, so that's this question number 4. So this is the accountability piece, and unlike Ohio, we don't have something like that. I wish we did, because we would use it with that argument. So the accountability is, we have had some legislators that say they just can't, they knowingly did this. They knowingly went in, and from our research data, we actually have some pretty good evidence that they did knowingly break the law. And they did do that. But again, we have no issue with that. The blood supply is safe. It's not on the individual to keep the blood supply safe. And then there's all these structural, mental health, economic, crisis reasons going on with the individual. It's only happened with plasma in Indiana. We've never seen it in whole blood. And there's a reason. You're getting paid for plasma, and plasma preys on, people who are economically disadvantaged and in crisis. And you only get paid $40 to $50, maybe. Sometimes there's incentives up to 90. And then there's an understanding. Some people living with HIV don't even understand that. And this is real, that plasma is a blood product. So when you say you can't donate blood, they see these plasma centers and they're like, well, I guess that's okay. Or they know that the blood will be destroyed because they know the policies. So they go and do it again because they're desperate. But anyway, the legislators don't care about that. For the ones who want to kind of hold people accountable for, they broke a law, even if it's an outdated law. So here, the question is, shouldn't they be punished and held accountable for their wrongful behavior? So an answer there is, well, in Ohio, this law doesn't seem to be used. It's not enforced. So it's not like you have people in droves doing this and getting arrested under this. But even if it were used, ideally, the best public health practice is a mental health approach to address the person's care needs. What's going on with this individual? How can we help? How can we support them? Assess their needs. And that's a better approach than to criminalize the individual, especially we're talking about a situation where there's zero risk to anybody of their behavior and what they did. But yes, for the legislator that still wants to hold them somehow, punish them, this is to answer your question, Brian. You can still punish people in those cases as one, Ohio has theft laws, minor theft laws, where you could be prosecuted for a misdemeanor for stealing $50, or fraud laws where you go in and you get some kind of monetary gain because you lied and misrepresented about who you are and you got paid. That would be fraud. I'm sure Ohio has some kind of fraud laws, but then you have that public health code as well. That's a misdemeanor. And of course, a misdemeanor is much better than a felony in terms of impact on a person's life. The reality is that law probably won't even be used because you're not really enforcing this law in Indiana, in Ohio. But you could do that. So you can use that as a talking point for this individual, that we don't need an HIV specific law that singles people out in the criminal code to prosecute people, because that leads into my next part of it contributes to stigma. You could use other laws. You know, we prefer if you don't and take more of a mental health approach if that happens, but there are laws on the books that you can use, and often that has been satisfactory to legislators who are really just dogmatic about, we have to hold these people accountable. And that's often a very kind of conservative political value is this accountability and responsibility for our, you know, individual behaviors and that sort of thing. Number 5, if the laws aren't used, why don't you just leave it? You know, just let it hang out there. How exactly do they add to stigma? People may not see the connection. And there's a few different connections you can make to stigma, but the ones I kind of came up here is just simply, I mean, we're being singled out and criminalized. Because of a law that tells us, you know, you are different than all these other people with different diseases that also can't donate blood, you know, because of policy, but we're going to subject you to the criminal law because you're worse than these other people. And that's adding to stigma. And then of course, stigma is a barrier to testing, engaging in care, and anything that contributes to stigma, we want to get rid of. So it's important to eliminate anything that contributes to stigma, including these outdated HIV criminal laws. And then you can argue that this bill essentially treats people with HIV. I believe it was someone in the very beginning in the chat here, maybe Ryan, I think you made the point that it'll treat people like everybody else fairly under the law. So like people with hepatitis B or hepatitis C who are also screened, they cannot donate. The policy does not change. The blood supply will stay safe, but they don't face penalties. Instead, they're going to be referred to treatment and services when they test positive. They don't have this potential felony possibility hanging over their heads. So those are kind of the main talking points that have come up in our state and questions that legislators have asked us. Safety is number one when we're talking to them. And then the biggest tool that we found the most helpful is that Red Cross letter. And we don't really bring up plasma too much unless they bring it up, because a lot of the everyday citizens are not really thinking the difference between whole blood donation and plasma donations and kind of the details there. So the Red Cross doesn't deal with plasma, they only deal with whole blood. So it's not kind of addressing the plasma industry. But again, plasma is even safer because of heat treating. It kills all viruses automatically, just kills them, wipes them out. So it's, and then they have the National Do Not Donate database. So I'll kind of stop there. And the good news is I think you can make progress. I think going with full repeal is great. That's what we've done. I'm kind of at a point, we've done it so many times, and we're kind of at a stall with our Senate chair of our criminal court committee, who has a personal friend. It's interesting, he brought up hepatitis. He's like, well, I have one of my best friends contracted hepatitis C from the blood supply. And I'm thinking, we're not talking about hepatitis C, we're talking about HIV. But in his mind, he convoluted, didn't matter. Like it was all the same to him. And then he saw the law as deterring people. Like, well, we need to keep it just because it's going to keep people from donating. And I didn't even go and start to have that conversation with him that, you know, I don't think this law is doing anything to stop people from attempting to donate. The other thing to know about is there's lots of people who donate blood and plasma all the time who don't qualify for donating, and they don't tell the truth on those forms. You know, did you have a recent tattoo? Well, I'm not going to tell them I just had one on my butt. You know, they're going to disqualify me from donating. You know, men who have sex with men, even now that the window is much more narrow, they may not disclose that so they can donate blood, but they're not faced with criminal prosecution. So we would, again, be treated like everyone else. But if you bring that up, no, the conservative legislators probably won't like those kinds of discussions. So I would just stick with the safety, the accountability, and the stigma. as maybe being your best talking points. And then talking to the committee members, that's where your lobbyists can be real effective. Each committee member prior to that committee hearing, and then for constituents of those committee members to talk to those committee members. So they hear from their constituents your concerns about this law. And then I think you'll be very effective going in and
So-
getting.
Thank you, Dr. Carey. I'm going to stop you because I have a minute left.
Oh, I'm sorry.
No problem.
Sorry.
I think it was fascinating. So
Yeah.
thank you so much.
Mhm.
But I do want to just cover very quickly. So what is next? So this bill will drop sometime this week and get a bill number. We are hosting a press conference at the State House Tuesday, April 23rd at 2 p.m. We don't know the room number yet, but our lobbyists are actively working on getting that room number. You are all invited. And please watch for an email from the OHMM Coalition for details later this week, the room number, etc. And if you're not on the OHMM email list, if somebody else sent you this information, please email me, kim@equalityohio.org, as soon as possible so I can get you on that list. When you come that day, we've got T-shirts and posters and pins that will be available for you to wear if you'd like to, but those supplies are a bit limited. We will be putting all of the things that Dr. Carey has talked about, plus some other things, into some a printed talking point, one for you to carry about what you might want to say, and we'll also put together something shorter for you to take and give to legislators, because after the press conference, we'd love you to go and talk to your own legislator about this bill. And I know I'm running out of time, and I appreciate if you have to go, but real quickly, what to expect. Sometime between now and December of this year, we expect Representative Sarah Crothers, who is our sponsor, to get sponsor testimony in whichever committee the bill is assigned to. We would be able to go and listen to her, but we wouldn't be able to give testimony. If we're lucky, we will also get further testimony, but the first thing would be sponsor testimony. And there are several paths forward. We will hold a follow-up webinar to discuss those potential paths. And remember that this is just the beginning. It's OHMM's full intent to work to repeal or modernize all 6 statutes. And we're going to take this opportunity of this bill to try to educate about the modernization of the science around HIV that we can use then to inform all of the future repeals or modernizations of the other 5 statutes. Thank you, everybody. I really appreciate it. Bye. So we're